So I'm here with nurse Zlata Risby. We're talking all things nursing here at Kirrawee Family Medical Practice. Welcome, Zlata.
Thank you very much. Lovely to be here.
So you're actually, you were here when I first started, I remember. And
Yes,
you've had a long and storied career in nursing.
I
Tell me a
have.
bit about how you got here. How did you end up at Kirrawee?
I think it was a nurse journey, I'd like to call it. Um, Having started off in general nursing
Yep.
in the 80s. So I have seen many changes, both in general practice as a patient and looking at it from a professional perspective as well, but also through the hospital systems, both private and public. So my experience has been varied in those fields, and I feel that coming into general practice, bringing that sort of experience from the larger clinical hospital world, it enables me just to bring together lots of knowledge, lots of skills, but in a different way, in that we get to see general practice patients in a different environment. So we're able to see them a little bit more comfortably, both for the medical staff and also for the patients that come here. It's a much more relaxed environment, less pressure for them, and the opportunity to have that ability to have time to talk to them a little bit more in regards to why they have come to the practice and what their problems and concerns are.
So I think that's a really good point you make about the comfort level with the nurse. Because I've seen, I've moved around practices a few times before I ended up here. And often, the nurse has had an ongoing therapeutic relationship with the patient for many years. And sometimes if something feels off with someone, I'll come and chat with you and see what you think about them. What does a day look like for you in nursing here? What sort of things have you done today?
Again, in GP land, there's a varied appointments that come across the nurses' rooms. Anything from dealing with the age spectrum. So we've got newborns.
Yep.
We have mums that are antenatal mums, so that they're coming into that parenthood stage. Then we have school age kids. And then we have that whole spectrum of middle age presentations of people, and also our elderly. So I think throughout the day, it's really important to tailor your approach as a nurse as to who you are actually seeing and why they're there. And having that initial rapport and being able to read the person when they come in, because I feel that everybody that comes in here, there's always a background story to why they've gotten here. So it's not always the immediate acute problem of I have a sore ear, or I've got a temperature, or I've got a bit of a tummy ache. There's usually that background stuff that's been happening perhaps over days or weeks even. And having that rapport and being able to read the patient with what they're saying and how they're saying it to you is really good. And it's a really good skill in history taking for the patient. And I do feel that a lot of patients will tell the nurse something that they may not tell the doctor.
Oh, absolutely. Yeah. We've all been there.
Yes. And that's no indication on, the doctor or why they would do that. I think it's just that different level of communication. And it's, again, really important that the nurse picks up on that and notes that, and then shares that information with the treating doctor, because that's something extra that could be very important that they would need in managing that presentation for them. So it really is a team effort and a team consultation between nurses and doctors. And it's really important that that team works well together because you want to get the best outcome for the patient. Yeah.
And you have to work with a couple of other team members too. Like if the receptionists are uncertain of something, they'll often escalate to you as the first port of call.
Yeah, and it's really important to make them feel comfortable to do that because we all have roles and we all need to work within our roles and within our scope of our knowledge and what we are able to do. And it's really sometimes very difficult for the receptionists when they get asked clinical type questions from patients, either on the phone or face to face, and they're really put on the spot. And I think sometimes patients expect an answer straight away, and they feel that just because they are in that clinical environment in a GP room, they should have the answer. So I think it's really important to make it very clear that we are all there to do our part, and passing things on does not mean that you don't want to do a job.
Yep.
It means that you're sharing that and you're making the best person for that decision-making process to take that on. And certainly the nurses would do the same on a clinical level if we feel that it's something that is outside of what we can provide, as in answers or actual care provided or tasks, then I have no hesitation in consulting with the doctor and making sure that that we're all on the same page and that we're doing the right thing.
I guess one of the things I've noted working with you is that you're always calm, like you're unflappable in a crisis, whether it's like I've called an ambulance or someone's just not well or we're uncertain what to do. I'm curious, did that come naturally to you? Is that a skill you've picked up over many roles and years?
I think that comes with experience. Yeah, I think it comes with experience, and also with a bit of the type of personality the person is as well. We're all individuals and we all have lives outside of work. So, I think it's the role that we take on and how we respond is sometimes conditioned into us with our experiences. And certainly working in the acute medical and surgical wards in the hospitals, you have to learn to prioritise and have that demeanour where you have a sense of control, because that's what the patient wants.
Yep.
That's what the patient needs. And getting the best outcome for them, you need to have that step-by-step process. And again, it's all about teamwork. And you have that demeanour and calmness because you have other good people around you that are also working for the same thing, the best patient outcome. So you know that we're all working towards the same thing. And at the end of the day also, you know that help is on the way.
You too.
So that also keeps me calm because I know I can reach out. Yeah.
Now tell me about the nurse-only appointments, because they're an exciting thing that's been added this year. It's really, I think, given you guys more ability to, how do I put this? It's given you increased scope to do the things you do with patients and provide extra hours in the day for the centre to see patients. Tell me about the nurse-only appointments that we've got here at Kirrawee.
The nurse-only appointments, I think it's been a great initiative. The patients seem to like them. The feedback that I've had from the patients is great because it's a time-saving appointment for them for something that can be done by the nurse and that meets their expectations and is done within our guidelines and follows policies and procedures, and we don't work outside of our scope of practice, and we are able to provide that service to the patient. It also assists, I think, and it's given me an opportunity to improve that rapport with the patient as well, because if you're seeing someone for routine nurse-only appointments quite regularly, they know. They know that, I'll be back again next month, or I'm in again. Particularly for our patients that have acute issues like wounds, and I love wounds.
Oh, a big problem in the healthcare sector, wounds.
And I get great satisfaction in following wounds through to see them heal and that the patient recover to their full capacity and function. So yeah, those sort of appointments, it's been a very worthwhile appointment both for the patients and for the nurses. Because it helps with, as I said, with our rapport with the patients, and we're able to also help the doctors as well in regards to a time frame perspective, that a lot of those sort of appointments that used to be with the doctors that we're able to take on, and it frees up time for the doctors to be able to see more patients.
So what's in the future for you? Like you've done a lot. Do you have things you're working on? Do you have big goals coming up? You just plugging away at everything?
I think my working goal is to hopefully retire from nursing from here.
Oh.
Yeah. Although I've been told I can't retire.
You can't.
But I feel I've made a very, very right decision for me personally. transitioning through that period of varied work within the hospital system, and then transitioning into the land of GP, which is very, very satisfying work. Very satisfying work. And I enjoy coming to work. I enjoy doing what I do. I enjoy seeing the patients. I enjoy working in such a great environment with great people. So for me, I think it's a great way to, and I'm going to say finish my nursing career. I don't think any nurse ever finishes their nursing career. Once a nurse, always a nurse. But you know, I would be very, very happy to know that that I've been happy in my last stage of my nursing, of my working nursing life. Yeah. So.
All right. Well, I think you actually have to get back to seeing some patients, so I will wrap it up there. Is there any final things you want to give us? Anything you're passionate about at the moment, or any jokes you want to give us?
I'm not a joke person. It takes me a while to get jokes. One of the things I am passionate about, and in regards to, again, it comes within the nursing and here, is our care of our elderly.
Yep.
You know,
I've seen that.
You know, I think there are huge gaps in what's available out there and what's practically available out there, not just in lip service or documentation or programs that sound fantastic, but how realistic are they, and how realistic are they for the elderly to get to? And I do worry about a lot of our elderly just falling through the cracks, and because there's such huge gaps in trying to get the services to the people that actually really need them.
Yeah.
So, you know, elder care for me is something that, you know, I do have a huge interest in, and I'm very compassionate and very empathetic with all our elderly people when they come in, because, you know, at the end of the day, they're amazing. You know, they've had this lifetime of experience and knowledge and memories, and you know, and we sometimes forget that. You know, they're just not the old person that's sitting in front of us.
Yep.
They too were once young. You know? So, and I hope people say that about me too, but I'm
too.
More senior.
All right. Well, I will let you get back to work. It's been a
Thank you
pleasure
so much.
chatting.
Thank you. Thank you very much.